So we've made some videos about how you can get into dentistry, and once you're in dentistry, how you can navigate your way around the university and whatnot and whatnot. There's still probably a lot to talk about, like what you can do after you qualify for dentistry. Think we might even chat about that today. So, but the main one is who should do dentistry? Should you do dentistry? You've been thinking about it. What might you expect apart from the intellect? You have the smarts, you have the brains, you have the face for it. Someone said you look like you're a dentist. I don't know what that means, but we'll just be going into those details, and hopefully it helps someone. My name is Craig.
My name is Surprise.
And welcome to Hills Talk, where we'll be just talking about teeth.
Can you shut up?
So, you're wondering, what qualifies? What makes a person a good dentist? Well, there is no trait that makes you a good dentist, you know, but there are a series of traits that can make you a good dentist. If you don't have these traits, you can develop these traits. Remember, we made a video about Antana. You're not a fixed entity. You can be anything. I am a monkey. I'm a banana. Or am I? But nonetheless,
Okay, yeah.
but you can develop, but there's certain traits you must be able to, demonstrate for you to survive in dental school and for you to survive in the world of dentistry. Um, one of these key traits is the ability to work under pressure. Yeah. Dentistry has lots of pressure. Now, it doesn't look like it, right? Again, it's just teeth, right? Like, well, what do you mean pressure? But it's very, very, how do I put this? Delicate work that you do. Remember, your tooth is tiny, and now this tiny object has to become this big object. So now that means that you have to have good, you know, attention to detail. You have to make sure that you're delicate. So yeah, so that creates a lot of pressure when you're working. There's a schedule. There's human beings on the other end. You pull out your needle and they're like, oh, and they scream, and people come with all types of trauma, and you have to deal with that and deal with the delicate work we do.
And the non-dental, non-clinical stuff that happens away from the chair as well. So basically, I don't, intelligence is very important in it, but I think the average human intelligence could learn this skill. You could basically, like, at the low end of average intelligence and the high end or a genius end, all of you could basically go through the program and succeed. But the guy who might even be on the low end of the IQ might thrive the most in the field. So it's not more about intelligence, more maybe temperament, ability to adapt to situations, um, ability to do repetitive, boring work over and over again without expecting instant gratification, or without like having people clap for you, even if like it was amazing work, or investing 5 years into a practice before it starts becoming profitable, or figuring out systems along the way which will fail, succeed on how to run the entire practice without actually seeing any results. Basically, a lot of the work that we do takes a while for you to actually reap the benefits. It's like gum disease. You get gum disease over a period of years, and to treat it also takes years. So coming here, having a diagnosis, doing a cleaning, a root planing, some surgery, all the results will show only years later. And even if you charge like a patient today, like 20,000 rands for one procedure, it doesn't always mean that 20,000 rands is coming to you today as is. For you to actually be able to just take 20 grand home, you have to do a lot of 20K procedures for you to just have just that little bit. So it does test your patience. quite a bit. So I think your temperament, your personality, and your ego, lack of, is mostly what's going to help you in navigating through the field.
Indeed. Another one I can think about is you have to be, especially if you want to enjoy the field, you have to be long-term minded, like super. Like, you know, how do I put this? There's a lot of procedures, right? And some procedures you're going to struggle with as you're finishing dental school. You will not even feel proficient in doing them. Like, you'll be like, at class 2, how do I even do a class 2? But to be good and to enjoy it, you have to kind of put yourself in situations where you're doing more class 2s, even though like you see it and your stomach just like turns.
Sinks every
It's
time you see it.
things, you know, you see like a molar retreatment of a root canal, and you're like, wow, wow. That looks, and you know, you're like, that looks hard. You have to put yourself in more of those situations, right? And this is why like having somebody or people who are ahead with you is helpful, because they can help you navigate those situations. But you need to put yourself in those situations. So you need to like, you know, invest in the putting yourself in uncomfortable situations. And you have to think long term, because you have to say, I'm not doing this for today. And in fact, sometimes you will do cases and make a loss on that case. Yeah, you'll make a loss. And this is where we'll get to like what you can do with the degree. This is why I'll get into this, right? Especially if you are in a practice that's like independent or independently run, you can take some losses on certain cases because you're learning. And that's the thing. And also you have to go to courses and learn more stuff, and you have to go and watch YouTube videos, but you have to think long term. You have to think, I'm here today, I want to be here tomorrow. So you have to plan and say, what does that look like? What are the key things I have to be doing today? What are the procedures I have to be doing today? What are the things I have to be reading up on today? Because if you do that in like 5 years, you will become this dentist and you'll be like, oh wow, like I never thought I could be that guy, you know?
True. And I think to do what he's talking about, to be able to plan ahead and stick to it and go through the whole boring thing, the most important thing that you should have is a lot of emotional control. So a lot of the things that you need with planning ahead basically is centered around your emotions. And that's not philosophy, that's science, you know. So it's a person who goes to the gym the first day definitely won't see any results, and they might even go for 2 months and not see any results, or some results, and it's only after like a year where you're like, oh. And for you to go to suffer every day in the gym eating plain white rice with broccoli and chicken breasts, you're not having fun. You're not drinking. You're not partying as much as you used to because you're trying to get to something and you aren't seeing these results. It does take a lot of emotional regulation, because probably to even be like out of shape, it was like emotional eating, or you know, it's like basically emotions are a very important part of it. So if you are able to control those, and practically, what do I mean by that? Every screw up, every mistake has a face. It's a patient sitting on your chair. You see their face, you hear their voice, you know their name. When you mess up, you might even know their lawyer. Throughout all of that, and you see about it's like 7 risks a day, or like 7 patients, but it's 7 times you might screw up. And you might do it sometimes, so but you have to be able to regulate that so you don't burn out, you don't get depressed, you don't get anxiety, and you don't get into like super dark habits by getting like, you know, vices that might disrupt your daily life. We all love vices, but like, you know, you need to have some form of emotional stability to be able to plan ahead and stick to it, so you don't lose your practice in like the 3rd year or the 7th year, you know, if that's what you actually wanted. But again, we don't only just have to open a practice, because Surprise did mention once you've graduated, there's a lot of things you can do. You don't have to do what we do. You don't have to sit and see patients every day. You could do that. A lot of the people who make a lot of money in dentistry actually just have simple practices that do simple procedures like cleanings, fillings, and all of that, and have maybe some other stuff around. But there's still a lot of ways that you can get into that. So
Yeah. And before we get into what you can do with the degree, all of this long-term planning, emotional regulation is worth it. It is worth it. It is worth it. I'm telling you, when you one day see your class 1 filling and you're like, or your class 2, and you do like a deep margin elevation and you go subgingival and it's white and it's clear and you just sit there like, oh, that's me.
I did that.
I did that.
That's me.
Like, that's me. Like, that's what happens. Like, when you put in all that stuff, eventually you start like becoming like super. Like, you do things and you think of new workarounds. Like, how did I even think of that? Like yesterday. Oh, shoot. I just have to tell you, I'm doing a post on call, right? The posts are too big. I just cut the posts with the handpiece and fit them in. And I'm like, wow. Bent.
You should have done a normal post a couple of times.
Exactly.
Yeah.
So like you will become so good that you will even shock yourself, right? And I'm not even bragging. There's a lot of dentists who just like, I don't even know how I did that, but it's putting in those repetitions. Anyway, what can you do with this dental degree? Okay, so the first option you can explore with your dental degree is corporate dentistry. These are your large groups, like Intercare,
Medicross,
Medicross,
M&S.
any group that's large, right?
Mhm.
The nice thing about these groups, the benefit is they have a big patient base. I mean, Intercare, I looked at Medicross is part of Netcare Group. So big budget just to market. They've got billboards, right? So they've got big budgets, big patient bases, and big trust and key locations.
Functional systems.
Discounts with suppliers. Look at that, rates of medical aid. So they just like kill it. They've got everything. And you walk in there and the practice is set and the people are coming and all you have to do is work.
Yeah, just be a good dentist.
Yeah.
Mm.
The downside, you're gonna work. Woo! You're gonna work. You are gonna work. You are gonna work, right? And the other downside is I don't know too much, but from just being there, you might not be growing as much as you could elsewhere. Meaning, if you want to try procedures which are not part of their normal range of procedures, aligners, you want to try something a bit experimental,
It might be a bit tricky. So because they have functional systems and you have to be function in the system. Okay.
So that's the downside is, yes, you have good income, good commission, good whatever. However, your growth, especially clinically to try things and to, do that long-term planning becomes a bit hindered.
Yeah, of course, you'll still learn a lot. You'll still do crowns, you'll still do dentures. You might even still work with like specialists and just, it's just for the rough, like one out of scope thing.
Yeah, for the
You-
other,
yeah.
for the things which are like, we didn't dive in too much into school. That's where you will struggle a lot. The next thing you can do is specialize. Yeah. You can be a specialist. So you can be a prosthodontist, a periodontist, a maxillofacial surgeon, oral pathologist, or public dentist specialist. I don't know what that is. But like you can go into a
What
specific.
do you mean you don't know what?
No, like I don't know what the word is, the lexicon, the normal.
Oh, okay.
Yeah.
Okay.
So you can like further your degree. You can get a master's and become a specialist in one key field of dentistry. It is going to be long. It's another 4 years on top of your 5 years, excluding primaries and all the work you have to do beforehand. So you're looking at about a 5 to 6 year journey
Yeah.
before you are a specialist.
So this was someone who probably wants more depth into understanding just one more field. It's not, there's less variety, but a lot more depth. And I think the ceiling is pretty high to reach like the height of being like one of the best in the field. It's not something you will do in a very short period of time. So it won't get boring easily, especially if you are academically inclined.
Yeah. And the other thing is it opens up a route for you to work in the university, work in academia, do research, and also research into like new cutting edge procedures for the next generation of dentists. So if that sounds like you, then you can explore. You don't even have to specialize to explore academia. You can explore academia just as a dentist, but just, focusing on one topic in dentistry. And then the other one is you can work at a practice. You can work at a practice
As an associate.
as an associate, as a hired dentist. You can work for the military. You can work for the government. This
So
one,
this is still like mostly clinical work.
Yeah.
Like you'll still be doing the regular dental procedures.
indeed, and each practice has its own set of procedures. If you work for the government, you'll be doing mostly extractions. If you work for the military, you will do almost everything. But
Depending on the base.
depending on the base, if you work for like a prestigious clinic, then you'll be doing like
Pink Hills.
yeah, you'll be doing like very like high-end procedures. Again, this is a cool route, but the downside is your bosses are us if you're working for like practices, and the small business owners can sometimes be very interesting employers. So
Yeah.
that's
Very different personalities.
indeed,
High expectations.
Indeed.
Sometimes, Yeah.
And government is cool, very safe, predictable, but can get very boring very quickly. Military, I don't know too much about military.
I got a buddy and a little bro in the military. They seem content. They don't like that they get deployed around randomly. And it is quite formal, quite strict, It's military. So you can't just hop up to work with just a random cap like this or a random golf tee. But I think it's satisfying. But I think all these paths are satisfying, but it is stable and definitely a path you can go for. Yeah.
And this is one role that you might not know of, but you can go work for a big company. So you can work, if you do academia, you can work for a company like Kulza in their research, 3M in their research. I know a couple of dentists who went down that route. You can work for a company like Align, which does Invisalign. So now you are like their clinical department. So you are like, okay, when you have this product, how does this translate to a dentist? So they have a lot of those. I mean, some of them will attend the course. They know the insights of the material and they know the application. They know some of the things clinically because they are the clinicians. They're the guys who use it. This opens up a lot of roles for you because now you are like in the corporate world. So now you can do corporate stuff. So if you eventually say, I don't want to do clinical dentistry, maybe do some research work and then try get into these roles because there are quite a few, but they're not like local. So you have to look. I think I saw the position for Align like on LinkedIn once. So they are on LinkedIn and stuff like that. And yeah, so that's another route.
Yeah. So these are mostly like the traditional ones that are outside of the typical work that you can do. But there's with new technology and times are changing, there's also pretty much a lot you can do. You could be a dental influencer. You think he's there?
That's us.
We are?
I'm joking. I'm
No,
joking.
I have 90-something followers.
Yeah,
that
lies,
But yeah, but you could be a dental influencer, basically promoting different dental products for different companies as well. You know what an influencer is. So you probably know a few dental influencers already online. I forgot their names immediately. I don't remember, but
Yeah.
like they exist. So you could be a dental influencer. You could be a dental comedian. I think I saw someone being that. That was
They're doing that.
yeah.
Isn't that
You could help with. You could work from home. A coach. You could be a coach. You
Yeah.
could train dentists on how to build practices, but that means you must have built a practice before, and you must have functional systems before. So you can help people, like people who are just coming out of government, people who are coming out of like school, someone who's just living also maybe the corporate dentistry, and they want to start their own, and they want to find their voice. So yeah, you could essentially just coach people into building businesses. You could help people optimize,
Preventing burnout.
preventing burnout. You could be a social media manager for different practices. If you've done your SEO, you've done your photography, everything that you need to just build an online business. You could help dentists do that as well. Could work with AI companies to help with diagnosis as well. Basically, the world is your oyster. You don't have to be on the chair just because you graduated in dentistry. There's literally so much you can do, but some of it you have to figure it out on your own as you go. Yeah.
And then the last one is you could join us.
You could join us. Yes, you can join us. So we are doing 5 years this year. And, I don't want to be 50 and still be doing this. So someone will have to replace me. So this is my recruitment speech.
And you can open your own practice if you feel.